A very warm welcome to all of our attendees this morning, to all our OPSA members, as well as those joining in from the other institutes, other areas of work, or even from other industries. We really want to say how much we appreciate you taking this time out. This morning, we do have some issues, technical, obviously with load shedding, with Wi-Fi being out, LTE not being as strong. So we do apologize if we do have any issues this morning. What we will do is, if we do not manage to get through it, we will record the session a little bit later on once we have the opportunity, and then make sure that we get it out to all of our attendees this morning. As a reminder, for the 28th of July coming up this month at the Royal Elephant Hotel and Conference Center at 6 o'clock is the Plumbing Industry Awards. So please get in touch with marketing@opsa.org if you'd like to join this event. Then coming up also, for continually preventing COVID-19, something that we have discussed, something that we discussed last week as well, that all employers are still under an obligation to manage COVID-19 within their organizations according to the hazardous biological agents regulations. So these protocols of washing your hands, if it's not available, using alcohol-based hand sanitizer, avoid touching your eyes, nose, and mouth with unwashed hands, social distancing, covering your cough, cleaning and disinfect frequently touched objects and surfaces, and vaccination procedures should still all be a part of a company's procedures and policies to avoid COVID-19 or to prevent it, spreading in your company. This would go along with any other hazardous biological agent. And as plumbers, we know that you are constantly exposed to these things when working with plumbing. So we realize that this can just be part and parcel of your entire health and safety management system. So today we are looking at appointing a SHE-Rep. How do we do that? But our safety thought for the week is Plan, Do, Check, Act. So that PDCA continual improvement plan helps us to not just plan for what we're going to do safely. In fact, PDCA can be used across the board with any type of business module. It can be financial, it can be economical, it can be health and safety, it can be quality. The PDCA module actually works for any type of plan. And that is because once you've planned to do certain work, you then execute that work by doing it. And then you do a check on it to see if it is actually being done correctly, if it is being done safely in this case, and then you act on any inconsistencies or weaknesses that you might find. Now, when you act on it, generally what you do is you're going to plan what to do for your action, you're going to do it, and then you're going to check it again. So this continual cycle helps us to continually improve our systems. When it comes to health and safety, appointments, COVID-19, completing an Annex 1, or any type of legal appointment, as we're going to look at all our Toolbox Talk this week or this month, we can see the PDCA module will always assist us. So let's get straight into appointing a health and safety rep. Now, according to Section 17 of the OSH Act, if you have 20 or more employees on your premises, you must appoint a health and safety representative who represents the employees to monitor health and safety conditions. Now, one of the key principles of the OSH Act is that work related to any hazards, risks, or dangers should be addressed through good communication. And that is communication between management and employees. Now, because the OSH Act also says we must be reasonable and practical, it allows for the appointment of a representative of the employees in terms of health and safety, so that the employer doesn't have to deal with 20 employees' issues, complaints, or any occupational health and safety concerns. What they do is appoint a representative on behalf of the employees who will then communicate directly with the employer and discuss any health and safety related matters between them. That will then assist the employer to spend more time and focus his energies or her energies on running the actual business, keeping the employees employed. Then the health and safety representative will address any health and safety matters relating to what the employees bring up, and this will then open those lines of communication. Now, what if you don't have 20 employees? Well, remember, this is the minimum requirement. And if your client or even the Department of Labor states that you must have a health and safety representative, even though you only have 10 employees, it is legally allowed, or your client is legally allowed to ask that, and the Department of Labor is legally allowed to ask you to have a health and safety representative, regardless of the amount of employees you have. But they cannot say that you can only have one health and safety rep after 30 employees, because that's going above the law. So we are allowed to strengthen the law. We strengthen the minimum requirements. 1 to 20 employees, you must have a health and safety rep, but anything less than 20 employees is really good practice. And so appointed representatives who represent workers, especially in regards to health and safety matters, is really just a good practice to have in a company. So perhaps you listening in at the moment, you think to yourself, well, I'm an employee. We've only got 10 employees in the company. Who do you speak to regarding health and safety matters? Is it the employer directly? Do you have a supervisor, perhaps, that you speak to? How is the actual functioning, the roles, the responsibilities of that person handling health and safety supposed to run in the company? Well, if you don't have a proper structure, implementing a structure like a health and safety rep with a proper monitoring, a proper communication, as well as proper procedures to be in place, this will help a company strengthen the communication between employers and employees. So if representatives are appointed, they form an important link between management and the rest of the employees. So it's good practice. If you don't currently have a health and safety rep, or even if you do have a health and safety rep, make sure that that procedure that is in place is strengthened by the correct monitoring, as well as the correct open lines of communications between each employee. So when it comes to the legal side of the appointment, well, obviously we know that it is a legal requirement, and representatives must be appointed in accordance with Section 17 of the OSH Act. But it is also very important to note that the appointment of a health and safety rep must also be done in accordance with the agreements as contemplated in the General Administrative Regulation 6. So General Regulation Section 6, as well as Occupational Health and Safety Act Section 17, are the two sections that we will use to appoint health and safety representatives. Now, if you're looking for duties or what the roles and responsibilities are for a health and safety representative, we're just going to look at Section 18 of the OSH Act. Now, if you want this information, this entire slideshow, in fact, it is going to be recorded, so you can go onto the IOPSA YouTube channel or even the IOPSA LMS system, and you'll be able to get this recording anytime. If you email us, we'll send you this information as well, either in PDF format or on this PowerPoint slide as well. And then we've also got the appointment template that we promised you for the health and safety rep as well. That will again give you a bit of a guide to either check whether your current health and safety representative appointments and procedures are in place and are they correct according to Section 17 of the OSH Act, as well as General Administrative Regulation Section 6. If you don't have a health and safety rep and you want to appoint one, well, then you can also use this as a guide in order to assist you in doing that appointment. So again, if you have 1 to 20 employees, you must have one health and safety representative. But as soon as offices or workplaces that are not very high risk goes over 100 employees, then you have to have an additional health and safety representative. If you work in a slightly higher or medium risk category, these could be like workshops, and plumbers would then fall into this category. If you have more than 50 employees, then you have to have 2 health and safety representatives. As soon as you reach that category, you have 2 health and safety representatives for your company because your number of staff have moved over to 50 employees. Then Section 19 and 20 of the OSH Act will then affect you. And why is that? Well, that is every time you have more than 2 health and safety representatives in a company, you have to establish a health and safety committee between those 2 she-reps. So Section 19 deals with the committee and Section 20 deals with those functions of that actual committee. But let's get back to the health and safety representative. Now, we spoke about General Administrative Regulation 6. Those are the negotiations and consultations before we designate a health and safety representative. So here's the direction directly from the Department of Labor on what must be done before we appoint a health and safety representative. Now, we're not going to discuss the entire piece of legislation. We're just going to look at the highlighted aspects. Number one is nominating or electing of health and safety representatives. Number two is the terms of office. In other words, how long will they be a health and safety representative for that department, as well as the circumstances and manner in which they will be removed as health and safety representatives. Now, that is a procedure that needs to actually be put in place. Then you need to have a procedure for how vacancies will be filled, the manner in which health and safety representatives must perform their function. So what is their duties? As well as what will the company do to provide facilities, training, and assistance in order to help that health and safety representative carry out their duties in terms of Section 18 of the OSH Act. So again, that's directly from Regulation 6, and this must be done before we appoint a health and safety representative. So there must be a policy or procedure in place on how a company is going to go about these 5 aspects: the nomination and election, the term of office, the circumstances and prescribed manner and how they can be removed, how you will fulfill and appoint another health and safety rep should that health and safety rep either be removed or leave the company, how they must perform their functions, and then what will the company do to assist them in performing their functions by giving them facilities, training, and assistance. Now, when we look at Section 17 of the OSH Act, as we mentioned earlier, this is the actual designation for health and safety representatives. Again, we're only going to be looking at the specific sections that are highlighted here. Section 17.2 mentions the arrangements and procedures for the nomination or election, period of office, and subsequent designation of the health and safety representative. So again, it refers back to General Administrative Regulation 6, and it states it in the OSH Act that this has to be done in accordance with both the General Admin Regulations as well as the Occupational Health and Safety Act. Now, the rest of 17 basically talks about the type of employee you want to appoint, such as only employees who are employed in a full-time capacity at a specific workplace and who are acquainted with the conditions and activities at that workplace can be eligible to be a health and safety representative. Well, we don't want to appoint a health and safety representative that is not a full-time person, because they need to fulfill their duties as a full-time employee as well. Then we also want to appoint someone who knows and understands the risks and hazards that the employees will face. You see, you cannot have somebody representing the employees on health and safety when they don't know the risks and hazards that the employees face. So what are we finding as a huge problem currently in the industry? Well, we've mentioned this to some of you. Some of you are our clients, and we just want to mention it to maybe the rest of you, especially our members. We're finding that a lot of our member plumbers are appointing their office ladies, their HR ladies, or even their receptionists as occupational health and safety representatives. But you see, they don't go to site. Yes, they understand plumbing perhaps theoretically, but they don't understand the site conditions that the employees are exposed to. And so the fulfillment of their duties in terms of assisting employees with health and safety is very limited. They are not able to fully carry out all of the duties in accordance with Section 18 because they don't fully understand, or as the law says, they are not acquainted with the conditions and activities. Now, what do we do to assist this? Does this mean you have to appoint a plumber who's actually doing the work? Not at all. So the person that you have appointed, perhaps it is the receptionist or the HR person, allow them just to become acquainted with those conditions. Remember, you can then perform in-house training to assist the health and safety representative to become acquainted with these activities. Help them to speak to the plumbers about what's happening on site. Get them acquainted with the risk assessments, the procedures. Perhaps even take them out to site when it's not very high risk so that you don't expose them to high risk, and go and show them exactly what is being done on site. Perhaps take photos for them and have a training session. Help the employees to discuss it with this health and safety representative. So yes, you might not be able to just appoint somebody automatically that has all of these boxes checked automatically, but you can work up to it. So we're not saying you have to change your entire system around health and safety representatives. What we are saying is just try and align it and get it to align to these sections. So again, if you currently have someone that's not acquainted, doesn't mean you're wrong. It just means you need to now align it with what the law says. So let's get that person acquainted with your workplace and the activities that are being done at the workplace. So again, employers, we are speaking to you directly. You have the responsibility in order to reach a collective agreement with your employees. That is to ensure the correct nomination and election of health and safety representatives, the term of office, circumstances and manner in which they can be removed, the manner in which vacancies are to be filled, the manner in which health and safety reps must perform their functions, and then also the facilities, training, and assistance that must be provided to help health and safety representatives. Now, we mentioned earlier that we do have templates for you. So we're going to show you the template for the appointment and election of a health and safety rep. And then we have other appointments like a procedure on General Administrative Regulation 6, which means all those things that you must do before you actually do the appointment. In other words, the manner of how you're going to replace a health and safety representative. What are the duties, the facilities, the training that you're going to provide? Again, it's very generic. So we're going to ask you to please, even with this template with the appointment, look at it and see how you can make it specific to your company. So let's look at the very first thing. The very first page of our appointment is the election process. It starts off by saying our company name, management, and employees hereby hold a meeting on the date of. You could put the date. Let's say you hold it on today's date, so then you'll put today's date in there. This meeting is held to nominate and elect a person on behalf of the employees. Now, what you can do, even on a separate piece of paper, or even if you have another name or duty sheet like you have sitting in front of you at the moment, name, surname, and signature, you can ask the employees who they would want as their health and safety representative. But just because the employees appointed that person or elected or nominated that person, we still have to find out if that person wants to be a health and safety representative. So it's good to get a few names. Perhaps 3 names to start with. If you have 20 employees, then 3 employees can be nominated as health and safety representatives with the approval of the employees. Those 3 names can then go onto a sheet to state that the first person who is then nominated will then be eligible to be a health and safety representative. Now, what's nice about having 3 names is you don't have to go and redo this entire election process should that person leave. One of the procedures that we have in our generic document is that of those 3 names, the second person whose name is there, if they are still in the company, will automatically be eligible to become a health and safety representative based on the first meeting held, which will be dated on this document. So automatically the next person would then be appointed. And so the next appointment will then be completed. Now, the third person's name will then also be there. And so you can see that should the second person not be eligible, perhaps they've left the company, the third person will then be eligible. Now, if you've run out of names, you can then just go ahead and do this entire election and nomination process again. But what we want to do is then say that this person has been elected for company name or could even be designated for a specific area within the company. And we then want to put the actual person's name in it. And we want to designate this responsibility from a specific date until a specific date. Our recommendation is if you do send your health and safety representative for formal training, either with a company like ourselves or another health and safety training company, that you appoint them for the period that their certificate is valid for. So if certificate is generally valid for 2 years, you can ask the health and safety representative to be a representative for the 2-year period based on the date of your certificate. You then say all those in favor of appointing the name of the health and safety representative, the first person, and all the employees will then sign to state that they are the ones who were in favor of appointing that specific health and safety representative. Now, based on this document, the employer can now legally appoint a health and safety representative based on the nomination by the employees. And this can come in the form of an actual formal appointment, as you see here. This is stating that it comes from OSHAC Section 17, the appointment either in Section 16.1 if it's a CEO, or 16.2 if they are the operations manager of the company, can then appoint the actual SHE-Rep for a specific period of time for a specific department. And then you will notice under OSHAC Section 17, the regulation, there is a duty list. Now that duty list can be changed, can be manipulated. It's actually generic because it's in accordance with Section 18 and then just general duties of what normal health and safety reps will carry out. And then you can change that to allow the health and safety representative to carry out all the prescribed duties that you would see fit for them to carry out for your specific company. Then they will accept it, but you also have to declare them as competent. Now, there's 2 ways of doing this. You'll notice on the right-hand side, you've got a declaration, and that would be a declaration by the person appointing the health and safety rep. It can either be the 16.2 or the 16.1, or you can have an actual certificate of competency. So the SHE-Rep went for training, they received a certificate, you can attach this to the appointment. Now, you either want this, the declaration of competency, or the actual certificate of training to prove that that employee was actually competent. Now, this will also then form part of your procedure for the facilities and training that needs to be provided in terms of getting your health and safety representative competent and giving them everything necessary to help your health and safety reps to perform their functions and look after the health and safety of their employees. So that's the template that we have available for you. That's the toolbox. That's how you go about appointing a health and safety representative. Now, as we mentioned, do your PDCA. If you haven't appointed a health and safety rep, or even if you need to relook at the process of your current health and safety rep appointment, do the plan, do, check, act. Plan to do it. If you've done it, then check if it's done correctly. Check if it is in accordance with the General Administrative Regulation 6, as well as Section 17 of the OSHAC. If it isn't, you need to act on it. We can assist you with that plan. Send us an email, info@ohss.co.za. We'll then assist you with those policies, the procedures, as well as these appointments, the election form and the actual legal appointment. Even if you need health and safety training for your SHE-Reps, we provide this as well. So perhaps we can assist you in training your health and safety reps to carry out their duties and responsibilities. So thank you very much for joining our Toolbox Talk this morning. We did rush it a little bit, so we apologize because we are having internet connective issues this side. So we hope you did get all of that. To look at next week's Toolbox Talk, we're going to be completing an Annexure 1 form. So we'll actually show you that legal document, where it comes from the General Administrative Regulations as well, why we need it, how you have to go about filling it in, and then where you must keep it once it's completed. And then to finish up this month, we'll look at legal appointments. So not just a health and safety rep, but right from a 16.1, 16.2, all the way to your site managers, supervisors, and any other appointment you might need on a site. Just a very big thank you to all of our members, and we're glad that we managed to get this out with load shedding still happening at the moment.